Hello, I'm Trevor Petrie. I'm a certified hand therapist and I've been working in hand therapy for 7 years. So the six-pack exercises, there's a couple variations on the six-pack exercise. The most common one that I've seen and that I use is you have the hand start in this position right here. You come down to what's called the hook. You come down to a flat fist. And then you come to a regular fist, and the difference between the flat fist and the regular fist is a flat fist you can see your fingernails. Regular fist, you tuck them in, and then you come up to a tabletop just like that. And then you return to the starting position. So straight, hook, flat fist, regular fist, tabletop, and up. In addition to those, each individual finger to the tip of the thumb, just to get each one of those tendons gliding. So what that series of exercises does is it gets every tendon and every muscle in your hand moving in different ways. That helps with the health of the tendons, the health of the muscle. It helps flush out any sort of inflammation that might be in the area. It encourages blood flow to all those different structures, and it helps keep those joints healthy because you're moving all of those joints in different ways. If you are doing any exercise or any activity and it is making your pain worse and worse and worse, you should stop doing that exercise. It seems very self-evident, but it's probably the advice I give the most to my patients. The way most people get themselves in trouble after an injury, or especially a repetitive strain injury, is you keep trying to push through pain and it gets worse and you're worse. And that's oftentimes why I don't give my patients a number of repetitions to do. So I usually don't tell people do 10 repetitions 3 times. Because if they start getting sore on the 3rd repetition, sometimes people will go, well, Trevor told me to do 10. And they keep pushing and they go until they get 10. And then they come back and they complain to me that my exercises are making them sore. What I always tell people is you can do as many as you like, as long as you stick with that rule of stress is good, pain is bad. You want to stress tissue as it heals. You want to stress the hands, the muscles, because that's how they heal better. That's how they adapt, is by the stress you put on them. But you can overstress them, and you can do that with 1 repetition. You can do that with 100 repetitions. It's really about the intensity with which you are doing your exercises, your movements, your activities. And so if you are causing more and more and more pain, you need to stop doing whatever it is you're doing, let that pain calm back down, and then if you want to come back and try it with a little less intensity and see if you can do it without unduly increasing pain, then you should try it again. You don't want to necessarily always protect everything 100% and keep it from moving.